Folks, thanks for joining us today. My name is John Dubas with Premier Marketing. We'll be spending the next 55 minutes or so discussing the roadmap that you have as an independent agent to sell Medicare supplement plans. We'll go into a bit of detail as to an explanation of the Medicare supplement plans themselves, a bit remedial for some that are already doing so. But we will also delve into the tools we have in place to help you in this endeavor, specifically electronic pieces there, and then, of course, marketing support that comes as part of it. You'll notice in today's software package where there's a question and chat section, we ask that you put your questions in the questions box. We find that we normally do cover them through the course of the presentation, but I will check periodically to make certain that we are addressing the particular need for information along the way. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. We'll have some specifics of that on where to locate some of those a little later in the presentation. I want to thank you for coming on and listening to us here today. We'll start with a bit of level set as to who Premier Marketing is. Many of you are very familiar with us, some maybe not so much, but we're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform, with offices across the country, licensed in all 50 states. We act as an insurance wholesaler working with independent insurance agents such as yourself through contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. That is done through a rather extensive portfolio of products, including the Medicare programs of Medicare Supplements, of course, our topic today, but also Medicare Advantage and standalone Part D prescription drug plans, PDP programs. We also have a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, along with disability income plans and ancillary benefits such as dental, vision, hearing, critical illness cancer plans, hospital indemnity, accident, and telehealth. We'll touch upon some cross-selling techniques as part of the tools we have for marketing the Medicare supplement plans and other programs that will be helpful for you. When we look at the Medicare Advantage plans, it has the national carriers and many of the strong regional carriers in there for your use. And that same philosophy carries over into the prescription drug plans, where in many cases, these programs are available as part of your MA contract, with a couple notable exceptions. Mutual Omaha doesn't offer an MA program any longer, and their PDP offering is a separate contract from any other type of contract you may have with them, including Medicare supplement contracts with them. The other thing of note here is the Clever RX is actually not a sanctioned prescription drug program, but a discount program available for agents. When we look at the Medicare supplement portfolios, well, it's pretty extensive. There's a lot of folks in there. One of the things that is normally a question is, who do I contract with? We're going to go into that in greater detail in a bit, along with the systems to help you be successful in that space. With ancillary products in each of the categories, the leaders in that space is there for you, creating not only a solution for the need of our prospects and clients, particularly in the Medicare supplement arena where, well, dental, vision, hearing programs are generally not offered. And if so, it's just a discount program for some of the med subs, and they don't all offer it. Other areas can be very helpful for you as well in the Medicare supplement space. When we look at the Medicare market overall, well, we've got a burgeoning number of folks coming on to Medicare. The silver tsunami, the aging of the baby boomers, 1 every 10 seconds, 10,000 plus a day. And if you look at it based just on age, well, you've got near exponential growth. That's true. But we're finding a increasing number of folks that are not accessing all of their Medicare benefits when they're first eligible at 65 for one reason or another. Pandemic has something to do with it. A reevaluation of life, in a manner of speaking, has something to do with it, but it whittles that number down a little bit, only for it to be positively affected by the 17% that are under the age of 65 accessing Medicare benefits because of disability. Keep in mind, the under 65 crowd has a different set of rules, or available plans, I should say, when it comes to Medicare supplements. We'll talk about that in just a second. Because those choices that are out there, well, folks don't have to do anything when they come on Medicare. They could even decline the optional Part B coverage. Most don't, thankfully. Some will self-insure for the shortfall and covering the medical expenses, pick up that standalone Part D to help with prescription drug costs. Some will bundle their coverages into those Medicare Advantage plans known as Part C as well. But many, depending upon income and other circumstances, will opt in to a standardized, modernized Medicare supplement plan and pick up a Part D program to cover those prescription drug plans. And that's where we spend the bulk of our discussion today. When folks do age in or access Medicare, regardless of age with their eligibility, we find that it's a pretty even split as to what they are choosing right off the bat. And it does make a difference as to our choices when it comes to recommending a program as well. And we see that the pandemic over the last couple of years has affected some of the enrollment choices that have come in. That death surge research survey is from 2019. We have another one here that is 2021 that gives a little bit of difference into those programs. So it is something to be very aware of, and is one of the reasons why we look at different programs and realize that there's no one solution for anyone. However, we're going to spend our time today on the Medicare supplement solution. And part of that is helping people understand what the language is for Medicare itself. Acronyms are part of any type of conversation with different segments of our society. Medicare is really, really happy to, well, not necessarily confuse folks, but to use a lot of acronyms. And so having a translation guide, no matter how long we've been in this segment of the world, can be very helpful. It also reminds us to be careful about the use of acronyms during our discussion with folks to make certain that they are understanding what we're speaking of. And if we do use an acronym, we define what it is as a point of reference. The election periods that we have, the standardized ones, well, we're pretty well aware of them if we're in the Medicare space with the AEP and the OEP and the special election periods and the special election periods. And many of you are going, well, John, what the? You don't need a special election period to enroll somebody in a Medicare supplement plan. Well, you do if you need to take them out of an MA plan. So we want to make certain that this information is available to you. And if you are removing someone from an NA plan for a Medicare supplement plan, you are cognizant of the fact that you need to help them with prescription drug coverage. Some folks will refer that out. Some will actually make use of the standalone PDP programs to accommodate the needs of their prospects and clients. It's important for us to keep in mind all those special election periods, because the vast majority of people on Medicare aren't reviewing their coverages year over year. And that is regardless of the type of coverage they have as base medical. That gives us an opportunity to make certain that we can visit with people year round as we look at some of the different segments of the population that are particularly affected by the fact that they're not reviewing their programs. But if you're reaching out to someone and they have not reviewed their programs, either on an MAPD plan, acronym for Medicare Advantage Prescription Drug Plan, or a standalone drug plan, the PDP programs, prescription drug programs, it gives us an opportunity to do that analysis for that individual and create a sales opportunity for us should that individual have a special election period, an SEP available to them. And that gives us the opportunity to go through and utilize some of the tools that we're about to speak with about Medicare supplement plans. They're not using the government sites even. So those other pieces of explanation that are out there for them, it's not happening either. That's why we need to be a source of information for the prospects and clients that we approach, and make certain that we have the tools to visit with them either in person or virtually, or pivot back and forth. That's important because it affects the software programs that are available to us through certain carriers that may be of great concern to you, but agents that are contracted with us have the applications available through MedicareCENTER and CSG, which we'll talk about, and it gives us then the opportunity to take care of folks in the manner in which they want to be taken care of. And it's important to note too that our target audience is becoming increasingly digitally savvy, and that's because, hey, they had to be. For those of us that have had doctor's appointments during the height of the pandemic and thereafter, we see a lot of physicians that are utilizing virtual appointments. We see that with hospitals even that are doing some different things virtually to help with connecting patients and practitioners at a distance. And nearly every state's Medicaid program is using some coverage of telehealth. So it even goes into dental coverages, where many of the services are being made available at a little slower pace with the dentist when it comes to helping people virtually. That's important because it gives us then the opportunity to do things in the fashion that best delivers the information, but gives us the opportunity to actually help people make a change. And so, as part of the roadmap for selling Medicare supplement programs, a bit of detail right up front, we want to remind people of the macro legislation where folks that are in Medicare prior to 1/1 of 2020 still have access to FC and high deductible F plans. Those that are new to Medicare after that point in time, 2.5 years nearly now, well, they don't have some of those same choices. So we want to be aware of the fact that different folks on Medicare are eligible for different Medicare supplement plans based on when they become eligible for Medicare. This gives us an idea then of the health plan choices within plan types within the Medicare supplement world that a person is eligible for. Many of you are very aware of this, but this is a really nice schematic that gives us the detail that we may need when we speak to people and remind ourselves, well, hey, when did they get Medicare? What are they eligible for? It's important to do that because, well, hey, every insurance company will decide what price they charge for their Medicare Medigap programs, the premium, and it's rated in 3 different ways according to the company that is being selected. You'll see the majority of them are in one category or another, depending upon the carrier, and we'll show in our live demonstration in just a little bit how we can determine what that is. It's important too that we realize the difference between open enrollment and guarantee issue periods for Medicare supplement plans. That open enrollment's that one-time only 6-month period where law allows us to sell Medicare supplement plans based on when that person has their coverage, their first month's coverage of Medicare Part B. That gives the individuals an opportunity to enter in a Medicare supplement program without medical underwriting or any layout clauses that may come into play with certain carriers. Guarantee issue, well, this is something where certain circumstances will give the beneficiary the opportunity to pick up that med sup regardless of health circumstances as well. It's important to note that the guarantee issue rights period and open enrollment can affect your commission with a Medicare supplement plan. And while that is Something we need to consider. We got to take care of our prospects and clients. Most certainly, it will give us an indication of programs that we want to make certain, well, hey, what's our comp on it? Plain and simple. It's also important to note that if someone is enrolling for a Medigap policy after their open enrollment period, there's no guarantee the company will have to take them. They can decline them if Medicare underwriting requirements are not met, unless it's a certain special situation. And we see that more and more often in certain states that may have an anniversary date that gives a person an opportunity for guarantee issue period. Or it's important to note too that if someone joins a Medicare Select plan, which we don't see as many of any longer, the programs that have a preferred hospital for plan procedures, that different changes can be approved or denied in certain circumstances. And it's also important to note that John did not delete the double slide there, that there are multiple reasons why a person will switch Medigap policies. They may feel that they're paying for benefits not needed and they're looking for a less expensive plan. They may have the reverse of that, where they want a more comprehensive program. And there may be a circumstance where they're not happy with their current insurance carrier and they want to change for that reason. Or the most prevalent reason is they want to shop to see if they can find a policy that's less expensive. So it's important for us to make certain that they realize they do have a 30-day free look period, and they shouldn't cancel their first Medigap policy until they've decided to keep the second one. That is something where the underwriting timetable for some of these carriers can be of great concern. And for some of them, it's a great way to say, hey, I want to work with this company, because they may well have immediate issue on certain policies under certain conditions. It's also important to note that these folks need to be really careful about if they drop a policy, what are the ramifications of that? Because there are folks that they haven't reached an independent source of information, such as an independent insurance agent, and they just drop their MedSup because it got too expensive, and they may or may not have even picked up a PDP program, that prescription drug plan. So it's a certain time period where they need to make certain that's done, and that's a 63-day period. If they don't do it during that time, we got penalties that come into play. So 8 things we need to know about Medigap policies. They got to have Part A and Part B of Medicare. It's different than a Medicare Advantage plan. It is issued by a private insurance company for the premiums that they create for the cost of that policy. And that premium is paid in addition to the monthly Part B premium that is paid to Medicare. Same as what happens with Medicare Advantage plans, unless there's a third party that is covering that cost. It's also important to note that there are a lot of times where folks say, well, I'm going to pick a Medigap policy and it's going to cover me and my wife, or myself and my husband, or whatever. Well, it's an individual decision, and both individuals have an opportunity to look at different companies, different policies, whatever is best for them. So much like PDP programs, where one plan may be better for an individual based on different medications, there may be circumstances where underwriting will come into play, or if one or the other is in a guarantee issue, or brain went dead there, a guarantee issue, or got to switch back because my brain is dead here today, sorry, or an open enrollment type of circumstance. Couldn't think of what I was trying to say there. It is important to note too that every standardized Medigap policy is guaranteed renewable, even if a person develops the health conditions, and they can't cancel, the company can't cancel that Medigap policy as long as the beneficiary pays the premium. The programs also come into play where some of the old plan choices that are no longer available, a Plan J, may have some drug coverages with them. You run across one of those individuals that still has a Plan J, one, they're getting pretty old, but two, they may not have picked up a standalone Part D program, and they're going to suffer a penalty for that. So it's also important to note that you cannot sell a Medigap policy for someone who has a Medicare Advantage plan unless they're switching back to original Medicare and leaving that Medicare Advantage program. It's also really important for us to note that there are some types of insurance that aren't Medigap policies. And they include the Medicare Advantage plans, the standalone Medicare prescription drug plans, Medicaid, employer or union plans, TRICARE, veterans benefits, long-term care insurance policies, and things that are set up for Native Americans. I know that might sound remedial, but some folks, when you get into a discussion with them, will bring up some of their other coverages, and we want to have a firm grasp as to, well, hey, that's not a Medigap plan. This is what you got. This is some of the things that may benefit you by looking at these programs. It's interesting to note that, well, a very recent Mark Farah survey speaks to the type of Medicare supplement lives based on the age of policy. This is important for us to note because one of the things that we see are some swings in the premium based on the carrier, how long they've had it in play. Gee, are they looking at a certain age bracket that's going to really drive up their premiums, or have they perhaps selected a program where the premium goes up for everyone? This gives us the opportunity to look at some things beyond the T65s that everyone wants to pursue. You may look at someone a year or two past that age that may be disenchanted with their original choice, or someone a bit older that has seen increases that they feel are unwarranted or unpayable, in a manner of speaking. There are different changes that have come about as to the most popular plan types. The F plan is still the predominant policy. Well, you want to look at that. Gee, you can't offer it in the last couple of years. So we see the growth in Plan G, the next most comprehensive policy. But the bulk of the Medicare population is still eligible for an F. You can still shop it for them. They can still enroll in one. So that gives us an idea as to what kind of target audience we're looking at to make certain that we are properly speaking of the programs for which they are eligible. Gives you an idea of some of the claims that are paid by Medicare supplement programs, which makes a difference because some of the different carriers that have market share will look at claims history, and the bigger ones are more likely to be able to absorb those claims. Some of the smaller companies may not be. Just something to consider. There are also different things that we need to be aware of that can help us with cross-selling. And that is the basics as to what Medicare supplements don't cover. They don't cover the prescription drug plans, so the PDP programs, MA, or the standardized Medicare drug plans are a viable cross-sell. Some folks will deal with it, some won't. Medicare supplements don't cover anything outside the United States. They pay based on what original Medicare pays, and original Medicare doesn't pay claims outside of the United States with certain exceptions. We also see that some folks will take out a Medicare supplement plan and think that it covers their long and short-term care needs, which we know it does not. And that most do not offer coverage for dental, vision, hearing, which is one of the more popular ancillary benefits that we see across the board. It's also important to note that Medicare supplement plans don't cover final expense and life insurance, another viable cross-selling opportunity. So when we look at some of the detail that is helpful for you, Premier has created a Medicare planning and evaluation guide specifically for Medicare beneficiary agents, not the beneficiary themselves. And this is available through your marketer with Premier and the folks that the agent success managers that help you day to day or as needed when you come into play with us as Medicare supplement contractors. Really cool plan, or a really cool document that helps you go through some of the different pieces that are there for you. And that's important because it gives us that opportunity to drive up our persistency. It's important to note that the more policies we have in a household, regardless of the carrier with whom they are issued, as long as they're with us, our retention is higher and grows with the number of policies that are there. So the cross-selling effort not only creates a revenue stream for the cross-selling product, but also keeps that Medicare supplement policy in place longer. We don't want to put all our eggs in one basket. Obviously, realize that one size doesn't fit all. And we have the MedicareCENTER program that's available without cost to our contracted agents. Sorry, I'm an old MA guy. I have a problem with the word free. It's free, but it has a universal login for multiple quoting engines and other tools, 3 quoting engines to speak of, powered by Connecture, Sunfire, and CSG. It gives us the opportunity to offer side-by-side plan comparisons for the different programs that are out there, and make certain that we can collect the scope of appointments through multiple methods and store it compliantly for that 10-year period as mandated by law, whether we sell them or not. That's important because if we're going to cross-sell, even though a Medicare supplement plan by itself does not require a scope of appointment, utilizing one can actually help us sell more product. So that's an important thing to consider. There's also a CRM that's available for you to manage your prospects and clients through this tool, and it offers other resources such as sales scripts and other things in the Learning Center that can help you. It is, however, where we can access the information for Medicare supplements through the use of that third quoting engine I mentioned, through CSG. It gives us the opportunity to work through and offer a complimentary Medicare supplement review, piling in the information we need to for different quotes on different companies. We're going to show you specifically how that works in just a moment, but it also gives us that opportunity to cross-sell. We'll talk about that too. So let's look at a live demonstration of that software package. You go through your MedicareCENTER login to get to, and I'm going through it, kind of bypassing that, to get to the quoting tool for CSG. That shows us these different programs that we saw on that previous slide. But when we go to Medicare Supplements to run a quote, it'll give us different detail to make certain that we realize that if, depending upon the person's age, they may not qualify for those plans that I mentioned per regulations through MACRA, but it gives us then also the opportunity to just plug in a little bit of information to run that comparison. You don't have to enter a client's name. Obviously, you probably want to if you're going to share it with that client and keep it in your files, but you select the zip code for the individual. Let's use this one. It's my home zip code. It'll give us the choice of 2 counties. We're going to look at a person that's not a T65 individual. Let's look at someone a wee bit older, a lady that doesn't use tobacco. We're sorting the analysis by price, and we're picking a plan F. Because remember, the most popular plan for folks on Medicare using a Medicare supplement, and it has the bulk of the individuals that are on Medicare. There are household discounts that can make a big difference into your choices if you have a twofer, in a manner of speaking. But let's look at it for a 1st of July effective. Obviously, depending upon the carrier you work with, it may not necessarily have to be the 1st of the month, but we've just entered in all the information that's necessary to get a quote. So in this circumstance, you hear the theme from Jeopardy in the background, do, 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 while the software package works on what we need to do. It's going to give us information based on premium. We will, pardon me, why am I going gray here? Oh, there we go. It tells us of updates of the e-applications available through this as well. So that's part of what we need to look at. But some of the things that we want to make certain that we do is look at discounts when applicable. That's that household discount. But let's include right away the additional information that is out there for the insurance companies through the market analytics program. And it'll give us then a way of also field underwriting to a degree as well. But what this tells us is what program is most price effective, efficient. What's the word I'm looking for here? Based on their current age and circumstance. It gives us an idea then of how that policy is rated, how the company is rated through AM Best. But remember that slide a bit ago that seems like ancient history now because you're talking so much, John? Well, it's an attained age rating. So that gives us an idea that the cost of the policy will go up as the person ages. And there is a secondary consideration when it comes to increases based on the entire book of business that, in essence, medical carries on the books. And you'll see that, hey, as of 9/1/2021, they decided they really wanted to be aggressive in getting business. And it gives you an idea of the size of their book. That also gives us an idea as to how they might absorb large claims. It'll go through and speak to the different pieces that are there with the different programs. Ton of carriers that are in this space, and gives us ideas as to what might be best for that individual. It also tells us that, hey, if I'm going to work this market consistently, I probably need a contract with Medico in order to offer that program, because there are some folks out there that will want the least expensive program, regardless if it's a so-called name carrier or Nightlife of Georgia or whatever it happens to be. And you'll see that in this particular zip code, that's Lewisville, Texas, a suburb just north of Dallas, that it is, well, feeble math, a little less than $11 of a price advantage. It will also be an indication that, gee, where's one of the companies we might know who they are as a general public? Because it's one of those things that, hey, if we're in the business, we understand the different carriers, the multitude that are out there. We're familiar with a ton of them. But there are some folks that won't know who Nassau Life is and what their advantages would be. And so where do we need to go into these different circumstances? And so that helps us with the explanation, and it gives us an idea as to, gee, what's the household discount? Is there a policy fee? What it doesn't tell you is how long does it take to get a contract with some of these companies? Some of them are very quick. Some of them are not. And so that's something to consider. When you look at, excuse me, the different choices that you have, it gives you then that idea of not only how you can present these choices, but your contracting options as well. Pardon me, fighting through a little bit of a upper respiratory and it's affecting my voice. So you'll see some things that will come into play in the companies that are there for you. It's also important for us to note, we can then take this information and save it to send it. We're doing this live with our audience through face-to-face on a laptop or through Zoom or another medium to reach out to the folks. We can actually just use the screen. However, we can save it as a PDF, or we can utilize an Excel sheet that will do some things for us on an informational basis that can help us with evaluations. I strongly recommend that if you share things with the public, you're doing it through the PDF, because it doesn't have some of the detail you're going to see as soon as this downloads that you'll want to be aware of and be prepared to pivot as well. And so let's take a peeky boo. Checking for questions here really quickly. Years in a market is one of the questions, and that's some of the things that will come into play. So it'll tell you how many years are in the market. Some of the carriers will utilize different insurance umbrellas, in a manner of speaking, to roll out different programs at different times of the year, still part of their company. And it gives us an indication of, did they do that to make certain that we can get the best price that comes into play? Or is it buying the market, buying their way into a market, whatever that concept may be? It gives us then that detail to help with the explanation. So you'll see that many of them are in space. And, well, as we talked about a bit ago, Medico's been in the market for 30 years, hasn't used any of those other companies, and took a big rate decrease. It reflects marketing philosophy, ways of doing business as well. And one of the things I really need to point out here too is the different quote options that I already showed to a degree, but I'm digging for one that will tell us this. Bear with me. Because not all of the carriers are participating with an e-app through this program. You'll notice that some do. So as we roll into this, we see that Great Southern, which is one of the programs that Americo is using, it has an apply now benefit or option that's available. Sometimes that takes you right to the carrier site to complete it, which isn't all bad. But it also gives us an indication then of how we need to be prepared for the enrollment process. So if we got somebody in there that doesn't have that apply now button, which many of these do, as you see, if I'm going to enroll somebody in the Cigna plan, I've got to be prepared for Cigna's e-app and to use it. So we have to be prepared with that. Cigna, however, and Aetna has some really cool programs that help you with cross-selling as part of their software package for their Medicare supplements as well. That gives us then that indication that we need. I'm going to show you this really quickly. Pardon me. But this is that Excel way of, pardon me, what we're looking for there. The different plans based on the plan type. So you'll see across the board what some of the detail is on these different programs. And how we can discuss their rates and everything else that come into play. So we want to make certain that we are doing what we need to explain these programs, and it gives us the detail that we have for the carriers in that market that are offering different plans. We got a high deductible plan F here. You see that the list isn't as extensive as you thought it might be, or we thought it might be, for these programs. So that gives us an indication then of some of the basics of how we map our approach for the different carriers that have an influence in our market. And that includes some folks that may be a little more expensive, but have more relaxed underwriting, standards for folks. And what this does also is it gives us an indication of, well, gee, let's say we've got a person 9 years older than that 69-year-old lady. Well, maybe it's her sister, whatever. We load that, and it gives us an indication of who wants the business at that age bracket. And we'll see that Medico is still the least expensive for it. It still gives us those details as to what happens with it, but it changes the order of some of the other carriers that follow upon it. In this case, not a lot of change in this zip code, But we have that opportunity to manipulate some of these pieces that come into play. And very important, we want to make certain that we're applying different discounts as well, because that can make a huge difference. It really does with the Mutual of Omaha programs that are out there. When we look at underwriting standards, pardon me, I'm reading through some different questions. That is some of the pieces that are right here. Pardon me. That button. So we can go through and it'll speak to known conditions. So we can kind of field underwrite in that area. Obviously, you don't want to attempt to put someone in a plan that they can't qualify for. And so kind of a, gee, I know you got diabetes. Is there, how does that affect that particular policy? Because we find that certain cardiovascular difficulties or diabetes, and you're not going to get them underwritten with certain individuals. The difference between compare quotes and universal compare, you have an opportunity to do a universal compare, which has all of these options, or you can select certain carriers and put them in the quote. You can determine what you want to show that individual based on contracting or certain circumstances. So one is you got everything in there that's available in that zip code, and then one is adding them to a comparison program specifically for your prospects and clients. So a great deal of detail in this that you can actually get in here and play around a little bit, and it really can help you save time and make certain that you follow through and speak to the different programs that are available. So let's say we're going to go back to a 69-year-old, but we're going to look at a plan G. It's thinking for us for a bit. Remember, the least expensive program for this individual at age 69 in that zip code for a plan F was Medico. In this circumstance, another thing that's going to pop up to tell us that, hey, yeah, I'm persistent in learning about what plans are available or applications are available electronically. But you'll see that it brings about a shuffling of the leader in that space. Medical is still very, very competitive, but you have Philadelphia American, New Era, by New Era Life. Philadelphia American's the subsidiary here in Texas that offers it. That is a bit less expensive when you look at that Plan G with that Part B deductible that comes into play. This is a carrier that is slower in contracting. So it's one of the things that we look at as to how quickly do you need these programs? How fast can we get you contracted with those organizations? It's also important that as we go through these different plans or carriers that are out there by the different programs, what marketing material do they make available and what marketing support do they make available? And that is dependent upon that different carrier. Mutual of Omaha, I'm going to bring them up because they have a rather unique marketing support program where you earn credits that you can spend on all sorts of things. You have enough credits, you can buy a laptop with their marketing support program, or you can fund a mailer, or a number of other ways of spending that money that you may not think of. Well, gee, it can help with the office rent, whatever it happens to be. It's also a way for us to look at some of the presentation guides that are out there, the other information that's made available to us through the carrier evaluations, and then how can we couple that with support from us here at Premier? Well, you'll look at some of these programs, and we'll go on through some of the things that will really delineate that for you. If you are looking to electronically contract with these carriers, depending upon the carrier, they may have a direct link that we send you to contract. Many of them are getting into that. That really expedites the process. Some of them have gone all electronic. Remember that carrier that was popping up number one? Well, they're pretty much all electronic now. This, however, gives you an opportunity to go into a system where you create an agent profile and you can contract with companies very, very simply electronically as well. And that's important that if we look into Medicare supplement plans, inevitably they talk about what do I get for dental coverage, or how does this help me with my cataracts or glasses off of a routine exam, because you got to know the difference as to how that's covered. This is a great way to help contract with multiple carriers very quickly and efficiently on an electronic basis. Everything's going electronic. We look at also offering discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? You contract with us for one program at least. It is, however, not like being added to a blanket E&O policy for just one coverage, and you have to look at how do I satisfy that requirement for the other insurance companies that I work with. You own this program, and it covers you regardless of whom you contract through. You get a better rate if you're going through Premier only, but it's there for you, and that rate for coverages wherever, because no one offers you contracts with every carrier that's out there. Little more expensive, but still a great value for you. We also want to make certain that we make available to you the different ways of making certain your license stays in play, and that includes discounting continuing education programs through our association with WebCE. We also offer a program where you can add to your own benefit package for disability income through a modified guarantee issue program in which you are paid a commission as well. Much as what I was mentioning before about today's presentation being recorded and made available in those different locations, well, we have that on a page on our website and on our YouTube channel as well. Not just today's presentation as it's uploaded, but past presentations as well. And that gives us an opportunity to say, hey, I market med sup policies. I want to work with the community either live or virtually in doing presentations through webinars or seminars or whatever it takes to reach the population. There are really cool presentations through the Medicare Learning Network about Medicare supplements on a generic basis that gives us a means of stoking interest in the plans that we offer and sales opportunities that follow. I mentioned that MedicareCENTER program. I cannot overemphasize the value of these programs with all it offers you as a contracted organization with our organization. I also mentioned that there are different marketing incentives that come into play. This is really important with Medicare supplement plans, because even if you're not basing what's offered there by commission or dollars that you get, most of us are a tad more altruistic than that. This will tell you of what incentives are available with the different companies that are out there. And many of the Medicare supplement plans will offer incentive programs on a commission basis based on your production per month. You do 3 a month, they're going to give you this much extra as a marketing incentive, that sort of thing. That will give you a great way of determining what's my total compensation package for these different programs. It also gives you the information that you need as to, well, gee, I'm really jazzed about carrier trips. What's it going to take for me to qualify for one being offered by company Z? Well, it's there for you. And all that information will help you understand and qualify for additional incentive programs through Premier as well. Some ways of reaching out to individuals. Well, there's a contact list custom ordered available for you that's available. Will be as soon as I clean up my issues with my subscription with that. But it gives you the opportunity to utilize our old trial tested relationship with Ma Bell. Smile and dial. because dependent upon the state, the majority of states allow you to cold call, and this is butted up against the do not call list, so we keep you compliant in that fashion. But I mentioned too that many folks will do some seminars or webinars based on centers of influence in the community. It's also something you want to consider if you're involved in retail, because hey, med sups are a big piece of that. The retail locations for marketing Medicare, well, they're more concerned about the PDP or drug coverage through an MAPD plan than they are about the base medical. So that can make a difference for us. But it gives us the opportunity to offer another hot button for faith-based organizations in the area that want someone to give an explanation to their congregation about different programs. You can have a whole menu of those that are put into play. It's also something that's important to note when we speak to different providers in the community as to what's in our bundle of joy of contracted carriers. Because depending upon the provider, most of them are very aware of, or at least the office administrative staff is, as to the payer mix going into that provider's office. And some of them want med sups as a portion of that. And some of them, even if they're contracted with one or more MA programs, will realize that, hey, that's not always the best option for my folks. And we want to make certain that if someone has a Medicare supplement plan, we have someone that can help them with that. Carrier generated prospects, this applies mostly to Medicare Advantage and PDP programs, where that carrier, as part of a quid pro quo situation, kind of, you scratch their back and they'll scratch yours in making leads available to you. We do have internet social media leads available as well, direct mail support, a T65 locator that's really cool, and a reminder presentation on referrals on how you can take one lead and grow it into multiple leads just simply by remembering when to ask, how to ask, and how not to take no for an answer with just one question. That lead program for direct mail is a discounted program based on productivity. You got two ways of qualifying for that discount for 1,000-piece mailer: through health programs and through final expense programs. You can qualify for both in a single month. We do so through preferred lead vendors because we vet these companies for the systems that they have in play to support you and to make certain that documents going out keep you compliant as well. You can really drive up a response if you promise them the moon. These guys don't, but we want to make certain that they're utilizing an approach that you're comfortable with, you discuss with that particular organization, and they're utilizing tools that are compliant. We do also have a way for you to access untouched direct mail responses to fill in your calendar or for other reasons, whatever it happens to be. The cost of these programs will vary according to the time of year and the area in which you live or operate. That's the old law of supply and demand. A great way for you to, however, to fill your calendar or augment any other type of marketing program. Those internet leads are through Facebook programs. There's a program set in place for final expense and for Medicare leads as well, concentrating a lot in the Medicare space on just Medicare supplements. I mentioned that really neat T65 locator. Well, this is a smart tool, downloadable upon your smartphone or your desktop, more effective on your smartphone. It gives you an opportunity to register for use of this program. Cost zero for you. That infamous hard word for me to pronounce, free. You register for it. They're going to check and make certain that you have a contract with us, gives you access for it, and it tells you exactly where these folks live, which is very helpful if you're between appointments and you like to door knock to fill the time, because you can compliantly door knock for med sups. However, we want to make certain that you're aware of the process of how we need to react when someone asks for programs outside of the Medicare supplement programs. We have a lot of folks that use this for final expense agents, do this all the time. Door knock for that. There are also other programs that are available for you to compliantly door knock, dental programs. It's a great way for you to use that specialized list that we talked about, but also a way for you to fill the pipeline based on under 65 folks, because even though it's a T65 locator, you can set the parameters as to the ages of folks that you're after. Really cool program, really helps out a lot of agents, all available for you without cost. We do all this because we want your business, much as where you want to grow your agency. We're looking to grow ours as well, even though, gee, we're pretty hefty, it seems like sometimes. Maybe that's just me looking in the mirror at my belly that I've grown here lately. But it also gives you an opportunity that if you're looking to become more effective in this space, commit to it. Get access to that MedicareCENTER program and to the CSG programs and put it as part of your program. I mean, you can do this immediately. The only Medicare supplement plan you've got to do any certification for is AARP. Some folks don't like to offer them. Some folks love them. Depending upon the market, that can make a big difference. But the vast majority of them allow you basically near immediate access depending upon your contracting process. So it's a great way for you to add this very effective tool and other carriers through this space. Bear with me a moment. I was checking for questions there that popped. All that said and done, that was my next thing to do anyway, is what are possible questions that are there? We covered them, it seems, through the course of the presentation. I want to thank you folks that have made some really kind remarks as well. But you can reach us at 1-800-365-8208 for more details. If you're working with a marketer within our organization, they're going to help you with this. If you're new to us, we're going to set you up with a subject matter expert to make certain this is taken care of for you. Keep in mind the recording of the presentation, once again, is on our website, premiersmi.com, and on our YouTube channel. So for those of you that have done business with us in the past, I sincerely thank you for that business. Thank you. For those of you considering doing business with us moving forward, I thank you for that opportunity. But most importantly right now, I want to thank you for the investment of your most valuable resource, your time, in listening to today's presentation. Hopefully you saw some value out of it, and it will be also available to you through our marketers that you're working with or will work with. All that said and done, right at the top of the hour, one little past our 55 minutes, I want to thank you once again for your time and participation in today's program. And until we're able to visit with you again, I wish you good selling. Thanks so very much. We'll talk to you soon.